Let us discuss today case conceptualization or case formulation. These two terms, case conceptualization or case formulation, are used interchangeably or synonymously. What is case conceptualization? Case conceptualization, in very simple words, is a description of problem development and resolution. Let me just tell you or share with you a few more definitions or descriptions of case conceptualization or case formulation. One definition of case formulation is: case formulation aims to describe a person's presenting problems and use theory to make explanatory inferences about causes and maintaining factors that can inform interventions. What this means is that it is essentially a story not just to describe but explain how a person's problem has developed and how it is maintained so that treatments can be based on influencing those factors. Another understanding of case conceptualization is that it's a process used to address, reduce, manage, or resolve the client's problems by developing a plan to tackle the problems directly or by working on the etiological and sustaining factors that are keeping the problems going. Case formulation is also sometimes known as clinical formulation. It's a theoretical explanation or conceptualization of the information obtained from clinical assessment. Basically, it constitutes a hypothesis about the nature of the presenting symptoms and varies from the categorical approach to diagnosis and provides a framework for planning the most useful and appropriate approach to treatment. The basic approach used in documenting and planning in both physical and medicine and psychological treatment, and it must be flexible enough to accommodate a new information and adjust for any improvements shown by the patient or the client. There are many different frameworks for case formulation, but several key elements are usually present. They are a description of the presenting issues, the factors that act to create vulnerability or precipitate the problems developing, factors that may not have been involved in the initial problem development but are helping to maintain the problems, and finally, factors that can help the person cope or act as resources. So there are three steps in case conceptualization process. First one is problem identification, also known as listing of client's concerns. Second step is thematic groupings, grouping the client's all concerns, all symptoms and signs into certain themes. Third is theoretical inferences, using the theory to explain the causes of the problem and to resolve these problems. This will eventually lead to treatment planning. Therefore, once again, let me repeat, as a clinical thought process, case conceptualization includes the following three theoretical or conceptual elements. First, problem identification, listing of client concerns, that is observing, assessing and measuring client behaviors, thoughts, feelings and physiological features. 2. Thematic groupings, using the observations, assessments and measurements to find patterns and themes in clients' concerns. And the third, theoretical inferences, as a function of the professional's theoretical orientation, using the patterns and themes to interpret, explain or make clinical judgments about the etiological factors, that is underlying or root causes, and sustaining factors features keeping the problem going, associated with persons' concerns, and finding ways to address them. This can be summarized in inverted pyramid method of case conceptualization. So this inverted pyramid method begins on the top first by problem identification. This involves identifying and listing all of client's concerns. Step 2, thematic groupings. Organizing these concerns into intuitive logical grouping, intuitive logical clinical thinking. This is grouping symptoms by similarities and themes. Step 3, theoretical inferences. Attaching thematic groupings to inferred areas of difficulty. Using theory, inferring areas of difficulty. And finally, narrowed inferences. Deeper client difficulties using theory, inferring the deepest areas of difficulties. Let's go over these steps one by one. To begin with, problem identification, identifying and listing all of client's concerns. In this step or in this process, first of all, as counselors, we must explore the presenting problem, explore the additional areas of concern, make specific inquiries into parental and family relationships. Thoughts, feelings, and behaviors during the session must be observed. Routine inquiries concerning health-related issues must be made. If need be, psychological assessments must be used. In other words, a detailed intake, case, MSc, and diagnostic history must be done. Additionally, if need be, assessments must be also undertaken. So this will give us a fair and a good picture of clients' all concerns. Through this process, we can identify all of clients' problems, symptoms that client has shared, concerns that he or she has shared, and the signs and observations that we as counselors have made. Then we move on to second step called thematic groupings. That means organizing clients' all concerns into intuitive logical groupings, intuitive logical clinical thinking, grouping symptoms by similarities and themes. This can be done in 4 ways. All of clients' concerns can be grouped in 4 ways. First of all, first grouping is known as descriptive diagnosis approach. That is, in this, if we classify or group symptoms in this way, we are looking for disorders, that is psychological disorders or diagnosis. This involves sorting together the different pieces of information about client's adjustment, development, distress or dysfunction to show larger clinical problems as reflected through a diagnosis. Example, putting all of the symptoms together to show a depressive disorder such as a major depression. Clinicians or counselors must use DSM-5 or ICD-11 when applying this approach. After listing all of clients' concerns, the signs and the symptoms, if you, as a counselor, if you have a doubt that this client qualifies for a diagnosis, that you must look for a corresponding diagnosis according to DSM-5 or ICD-11. Look for a possible diagnosis and see whether the client's concerns, symptoms match the criteria of any psychological disorder. Another way of grouping into a theme all of client concerns is clinical targets approach. That is, sorting client information according to the basic division of behavior, that is distressing or maladaptive, thoughts, distorted or irrational beliefs, feelings, that is distressing mood, and physiology, problematic physical aspects. Here the counselor's logical intuitive thinking is moving toward inferences, interpretations, treatment focus, and treatment planning based on these 4 areas. Next, or rather another way of doing thematic groupings is known as areas of dysfunction approach. In this approach, a counselor sorts together areas of dysfunction according to important life situations, life themes, or life roles and skills. These are according to areas of external life functioning. Here the counselor organizes or groups according to the effect of these symptoms on clients' everyday life. This may be compared to this example. If a student has a difficulty in his role as a student, that in studying he cannot study, he cannot concentrate, there is not a motivation to go to college, or he cannot study certain subjects, that means these problems are arising because of his role as a student. Or as a child, as a son or daughter, he or she has difficulty in his or her relationship with parents. This is because of his or her role as a child in relationship with parents. Or he or she may have certain difficulty in adjusting to a new place or a hostel or a new college. This is again coming because of a particular life situation. Or a woman may have a difficulty in her role as a spouse, as a mother, or as an employee in an organization. So these difficulties come because of that woman's particular roles or life situations. So this is one more way to group the symptoms or signs or concerns. Finally, the 4th way of grouping, thematically grouping client concerns is known as intrapsychic approach. That is sorting together the different pieces of information about client's adjustment, development, distress or dysfunction to show clinical patterns in the ways life events are associated with a person's personal experience and identity. That means this refers to a person's internal or intrapersonal functioning. So this grouping one may not use if one doesn't understand it, but is fairly good enough to know the first 3 areas of thematic groupings. That is, looking for disorders, that is descriptive diagnostic approach, clinical targets approach, sorting client information according to the basic division of behavior, thought, feeling and physiology, and the third one is areas of dysfunction approach, sorting together areas of dysfunction according to important life situations, life themes or life roles. Then we come to the third step, which is known as theoretical inferences, that is attaching thematic groupings to infer areas of difficulty. In this step or process or stage, a counselor uses a theory to infer the areas of difficulty of the client. Here an attempt is made to tentatively match the thematic groupings or constellations developed in the previous steps to areas of difficulty according to the counselor's perspective or theoretical orientation. Here the previously identified symptom constellations are refined to reflect inferences about deeper aspects of causal roots of the client's difficulties. It simply means that a counselor applies theory, uses the understanding of a theory, concepts of the theory to explain the client's problems. For example, based on the groupings, based on the client's presenting problems, if a counselor has identified that client's basic problems are behaviors, he may look at Skinner's theory of operant conditioning. What is the maladaptive behavior? What is the behavior to be modified? or if a counselor finds out that there are associations of feelings and behaviors, he may look at classical conditioning theory and the concepts of that theory, where the client has problems because of his associations and therefore he needs to address it using a behavior theory. Or with if a counselor finds out that client's basic problems are thoughts, all of his problems are coming because of his way of thinking, whether the client has distorted thinking or cognitive distortions, or the client has irrational beliefs, then he will look for what are activating event, what are the emotional behavioral consequences. So, or one may also look from a gestalt perspective, whether client's problems are because he or she is not experiencing the here and now. So based on this kind of interpretations, a theory's concepts are used to explain client's problems, and the techniques involved in this, available in the theory, are used to address, reduce, resolve client's issues. Still, there is a fourth step in case conceptualization process known as narrowed inferences, that is addressing the deeper client difficulties. Here the counselor uses a theory to infer the deepest areas of difficulties. The counselor forms still deeper, more encompassing or more central causal themes when they are present. These themes are distilled further into existential, fundamental or underlying questions of life and death, suicidal or homicidal thoughts and meaning of life issues, deep-rooted shame or rage, extreme loss of identity, fragile personality structures, or other deeper concerns. In this stage, a counselor applies the theory to the most threatening, scariest, darkest, more disruptive and despairing client difficulties. So therefore, we may understand that step 3 addresses the simpler or surface issues of the client, which are very obvious. In step 4, a counselor or therapist uses a theory to apply to the deeper or complex issues of the client. If there are any deeper issues, it is the counselor's task during treatment planning to determine whether they should be addressed. Now let us look at a case of Sienna. This case is from a book. Sienna is a 16-year-old girl, is 8 months pregnant with her first child. She says, "I wonder when I'll be able to see Freddie," that is the baby's father again. "I mean, I want him involved. He wants to be with me and the baby, but my mom wants me home. His mom said she's looking for a 2-bedroom apartment, so we could possibly live there. But I know my mom will never go for it. She wants me to stay with her until I graduate high school, and well, to be honest, so that this will never happen again." She points to her belly. Let us see how we can conceptualize this case. Let us go step by step. First one, problem identification, or listing all client concerns, or observing, assessing and measuring client behaviors, thoughts, feelings and physiological features. The case that we read is only a bit of the entire case history. The counselor who has actually seen Sienna has access to more and detailed information about the client. Based on that, the counselor has suggested this. When explored all of Sienna's areas of difficulty, number of problems emerged. Symptoms of depression, including low mood, troubles with sleep, appetite, concentration and energy level. Difficulties in relationship with several people in her life, including feeling dependent on a boyfriend, conflict with her mother. Second, thematic groupings using these observations, assessments and measurements to find patterns and themes in the client's concerns. First, the counselor grouped together all of Sienna's moderate depression symptoms, depressed mood, melancholic rumination, sleep disruption. This was the one group. Second one, CNS dependent relationship issues, conflictual family ties, passive romantic role. Third group was a theme of identity confusion was formed from her unclear academic goals. Step 3, theoretical inferences using a theory to explain and interpret CNS concerns. As a function of the clinician's theoretical orientation, the counselor, from a humanistic perspective, came out with this understanding. So using a humanistic or person-centered perspective, CNS depression, relationship dependence, and general anxiety about life choices might come together to lead to theoretical inferences of low self-esteem or poorly developed self-empowerment. Further, according to the humanistic perspective, it might be inferred that a poor self-esteem was rooted more deeply in feelings of having a flaw, the sense that something is terribly wrong with me, that come from experiences during her development. Alternatively, for the clinician using a psychodynamic perspective, CNS 3 symptom groups might be conceptually related to autonomy difficulties, fears of becoming a fully functioning adult, independent, who is emotionally independent of her family. Further, according to the psychodynamic perspective, it might be inferred that her autonomy difficulties are tied to fears of disintegration. Namely, I will be overwhelmed by my own independence, or fears of abandonment. That is, I will lose my family relationships if I am successful. And using a cognitive behavioral perspective, seen as passivity in relationships and her avoidance of making important life decisions might be explained theoretically by negative self-talk and having learned ineffective interpersonal behaviors. The clinician's theoretical perspectives and the way client's case is conceptualized will lead to a decision about goals to be accomplished in counseling and a conceptually driven plan for treatment to reach these goals. Let's look at one more case. This is about a 14-year-old 9th standard girl from middle socioeconomic class. Her presenting concerns are, my mother always shouts at me, she does not like me at all, she criticizes me for almost everything. She comments about my dress, my hairstyle, the shoes I wear. She doubts that I have a boyfriend. She nags me for each and everything. I feel disturbed, angry, and feel like running away from home. I don't feel like studying, and I feel like not talking to anyone. I'm not a small kid. I want to have some freedom to do some things in my own way. So let's go to this process of case conceptualization. First of all, problem identification, listing all client concerns, and then thematic groupings. So concerns of my mother always shouts me, she does not like me at all, she criticizes me for almost everything, she comments about my dress, and so on. She doubts, she nags for each and everything. So these are about what she feels, what her mother does to her. This is the way she's talking, this is the way she's thinking. So basically this can be called as negative self-talk, or we can also say that these are her thoughts. Then about feeling, I feel disturbed, I feel angry, I feel like running away. Running away is a behavior. Her feelings are anger and disturbance, maybe sadness, maybe disappointment. Then she says about her behavior, I don't feel like studying, and I don't feel like talking to anyone. So she does not feel like studying, doesn't want to talk to anyone. She feels like running away behaviors. And she also says that I'm not a small kid. I want to have some freedom. She talks about freedom. So thoughts, feelings and behaviors, these are the thematic groupings. Now what are the theoretical perspectives? From a developmental perspective, we may use Erik Erikson's theory of psychosocial development. She is in the 5th stage of identity versus role confusion. From a cognitive perspective, she is in the 4th stage of cognitive development. She's in the formal thought operational stage. She finds fault with parents. She questions their understanding of herself, their control over her. She is able to think for herself. From a cognitive behavioral therapy perspective, we may say she has cognitive distortions because she says, my mother always shouts at me. She does not like me at all. My mother criticizes me for almost everything, and so on. So these statements refer to all or none thinking, which is a cognitive distortion. We may also say from these statements, using a cognitive behavior modification theory of Donald Meichenbaum, that she has negative self-talk. Basically her problems are because of the way she is talking negatively. So one way to change her, address her issues is to lead her from negative self-talk to positive self-talk through self-instructional training. So this is in brief case conceptualization or case formulation.